Okay, so here we are going to do our quadriceps contusion wrap. So we have our midfield in soccer here. So we've done our hospice assessment, our clinic or sideline assessment, and we've realized she has decreased strength and decreased range of motion in the quads and knee joint, so she cannot go back to play. So this wrap is not so she can go back to play. It's just allowing helping healing and adding compression and things like that. So before we start, is it okay if I touch you? Okay, and so we are going to take PMS, so checking cap refill, 1, 2, 3, can you feel that? Perfect, can you lick your toes for me? All right, so now we've done that. We're gonna ask the athlete if they've ever been taped before. Have you ever been taped before? Mm-hmm. Are you allergic to any tapes or sprays? Mm-hmm. No, perfect. So for this, we are going to want to put our pressure pad right over top of the contusion. We can see she's bruising right here in the middle of the thigh area. So to stick our pressure pad, she's not allergic to any sprays, so we're gonna use our pre-tape spray, put that right on the skin where we are going to be taping. So we can use our zinc and we can fold it. That's not good. We're gonna fold it into our, so it acts as a double-sided tape. Put that in the back of our pressure pads. We can stick it on the mid-thigh where our contusion is. And just notice we want our athlete in our tandem stance with the affected leg forward, knee slightly bent so the muscles are activated, heel elevated, which keeps those muscles activated. And we want our hips always square to the therapist that is doing the work. And we're gonna add one more double-sided strip. And we've already taped, we've already sprayed so the tape will stick better. So we're gonna apply our pressure pad right onto the skin, right mid-thigh to cover the contusion. And then now we will be using, well, we can also put one more strip of zinc, double-sided zinc on there, so the tensor band won't move around, just for some added perfect. So now we can go ahead and use our tensor band, wrap that over top of the thigh, trying to avoid the back of the knee joint or going too high up on the thigh, close to the hip joint. And using our dog ear, so that tensor band is not going to move around too much on the first one. Okay, now we can go into our herringbone technique, make sure the X's are all the way down the front of the pad. So down, and up. I'm using the whole tensor, trying to avoid any wrinkles in our tensor band, and finishing on the front of the leg. Because anything in there, if she's moving around, it might just fall off. So I'll get you to hold that for me, please. And we can lock that in with a couple strips of zinc. Thank you, it's good. And we want the compression here. Even though she's not going out to play, it's gonna help with the swelling. So after this, we're gonna add 2 or 3 pressure strips over top of the pad. And we're gonna get our athlete to lean into us, so those pressure strips will apply a little better. So we're just gonna measure it. We want 1 at the bottom. We're gonna start from the bottom, work our way up. 1 at the bottom, 1 in the middle, 1 around the top of the pressure pad. So whenever I push this tape into you, you're gonna lean in towards me, okay? Mm-hmm. All right, go ahead. Perfect. and one in the middle. All right, same thing. Awesome, and then we're gonna put one more towards the top. And one more time. Perfect. And just to keep it all safe, it's not super necessary, but we can wrap this in our ultralight. So now that that's done, we're gonna go ahead and recheck PMS. Cap refill, 1, 2, 3. Can you feel that? Perfect. You wiggle your toes. Awesome. And again, her hips are square to me the whole time. You can go ahead and step off the block. Does that feel comfortable? Feel supported? Perfect. So since she's not going back to play, not really necessary to get her to do some sport-specific movements, but we're going to educate her on police for her home program. So we protected the area using our pressure pad and all our bandaging. For optimal loading, if you have crutches, you can use crutches to keep your weight off it. More or less just keep your weight, no activity. She's gonna come back and see me tomorrow at the clinic. So we'll reassess her strength and her range of motion tomorrow, but try and stay off it, try and lay down. Whenever you're laying down, you can prop your leg up on some pillows to help alleviate some of that swelling. And when you're in bed, you can put some pillows at the bottom of your bed to keep your feet 4 to 6 inches above the heart, to keep that blood circulating. If you want to ice it, you can ice it, but you want to keep it off for triple the time you had it on. So if you have it on for half an hour, if you have the ice there, you're going to want to have it off for an hour and a half or until the area warms back up again. Whenever you put ice on, you're going to feel cold, burning, aching, numbness. Whenever you feel the numbness, take the ice off, and then again, triple the time before you put it back on again. And compression, we've added those strips on there. During the night, you can leave this on if you want. When you come back to see me, we can take it off. But if you feel it too, start to feel numbness down your leg, if you start losing feeling at all, make sure to keep scissors by your bed. You can cut all that right off, cut even my tensor off, or you can just take the whole thing off. And then again, she'll become back in the clinic to see me again tomorrow.